it's getting serious. Doctor, to stand back again, trying to understand what it takes to be a doctor in modern times. Is it knowledge? Amazing if I could learn that whole book, but a computer could do that too. So also you need procedural skills to be an effective physician nowadays. So we're going to learn some of the basics, the ABCs of emergency resuscitation. Who knows what A is? Remember A? Yes? Who said that? Fantastic. Are you in the medical field? Yes, you know it. You know what to do. You had a patient who was unconscious, right? Not breathing properly. You might have to make sure they have a patent airway. I won't eat it. Now might be another good time for a disclaimer. Whatever you see tonight, I promise you, nothing dangerous is actually happening. I would not be that stupid. I am literally a trained professional, a licensed physician and surgeon. The thing is that, I know you look away, but does that really look like that's jammed in my skull? Yeah. It really kind of does, doesn't it? The thing is, you ever got a proper COVID test? That's what should do that, right? The thing is, this is jammed deep in my skull. Can you thoroughly examine that? Confirm everything. That does not collapse.
I taught preschool, so...
Okay, close enough. That's adequate. That's not more difficult. Looks good, looks good. All right, fantastic. This is not a magic trick, people. This is just human anatomy. Cutaway of your head. You actually check your nares, your nostril. The cotton swab really does go in the nose, and it really does penetrate deep into the skull. There's a very large nasal cavity here. When you understand the human anatomy, it's a perfectly rational explanation. With that in mind, let's move on to B. What is B for? A is for airway. B is for breathing. Oh, who got that one? Fantastic. Just a guess, or you're all over it? Ordinary things. Maybe the airway is open. What if your patient had a large pleural effusion? A fluid pocket builds up around the lungs. They can't expand properly. They can't breathe properly. So what would you have to do if someone had a very large pleural effusion? They can't breathe properly. Thoracentesis. Take a thoracentesis needle. Stab the patient to the back. You put a drainage hole to allow the fluid to drain. Now, I don't actually have a fluid box, so it wouldn't make sense to actually stab me in the back here. So I will just demonstrate for you the skin penetration technique. This would be the moment now you need to avert your eyes. This is actually very hard. It's actually very hard to penetrate skin. Skin is very strong. You need a very sharp needle, firm pressure to penetrate through the skin. You can do that. Now you can create Ow. Oh, I don't know if we can get this through. Skin is very strong. There we go. There we go. Of course, you don't want to leave. When you understand the anatomy, you've already the neurovascular bundles, everything's fine. Now, you don't want to leave a sharp needle in the patient, right? That would be dangerous. So what do you got to do? Follow the blunt guide wire. Follow the needle guide wire. Depending on which Seldinger technique you use, there are many different techniques. There you go. Now that the tract is maintained with the blunt guide wire, you can safely remove the needle. You don't have to worry about any more serious injuries happening at that point. Is there a doctor in the house? Is there a practicing doctor in the house? Preferably a surgeon? Hang on. I think we're in trouble here. I'm just going to have to go. Heather, what was your name? Rosemary, could you just grab the end of that wire and just slowly pull it towards you? Hey, how are you going to make it through medical school? You can't stand one procedure.
I went to the medical school.
There you go. C is for circulation. Make sure you stop any active bleeding before anybody suffers any permanent injuries along the way. All right, fantastic. Let us see if any learning has actually occurred. What is C for? Circulation. What is B for?
Right.
Breathing. And A is airway. If the man is just certain bleeding, I guess some blood. But, hey, hang on, let me see if I can just clean this up a little bit and make myself a little bit more presentable. There, we can carry on along the way. I once did this for some students. I read their minds, build this up. He's like, how'd you change your shirt? I just read your mind and stabbed myself and going out. So now let's move on to what do you do if somebody's airway is obstructed? Trauma through their nose or coughing up blood. They cannot breathe through their mouth. What if there was a small foreign object passes into the mouth, goes lodged into the back of the throat, obstructs their upper airway, gets lodged behind the thyroid artery. Your Adam's apple, that's your thyroid artery. What you would have to do, you would have to slice a hole through the cricothyroid ligament, creating a surgical airway. I am not making this up. This is absolutely, am I making this up? I'm not making this absolutely legitimate. In fact, for your education and entertainment tonight, I'm prepared to deliberately choke myself to demonstrate this technique for you. Don't worry, there's a life-saving hole in the middle here, so we'll see what happens. I don't know. Well, how are we going to learn? How are we going to learn? I'll move it up and get down.
Don't show any of your cards out.
Surgical airway, absolutely legitimate technique. Yes, Dr. Newman?